everyone. I'm Sanvi Parmar, a student at the Faculty of Law, Maharaja Sayajirao University of Vadodara. Today we have Mrs. Suzanne Sampson, founder of Faith Foundation India, an organization that has spent nearly 2 decades working at the grassroots to advance in women's healthcare, HIV/AIDS, menstrual hygiene, legal aid, and policy reform. In this episode, we explore what it takes to build systems that respect women, bodies, choices, and lives as well. Ma'am, as a first question,
Yes.
could you begin by telling us the core areas of work that Faith Foundation works in, that it focuses on, and how does it specifically focus on women's health and hygiene?
Okay. Faith Foundation primarily work on de-addiction, tobacco control, women entrepreneurship and empowerment, life skills amongst adolescents and specifically among adolescent girls. We also work, we have our slum schools wherein we educate dropout children and special focus on girls as well. So these are our core areas. We also support PLHIVs. These are people living with HIV under our HIV care and support program. So majorly 5-6 programs. Yes.
Yes, ma'am. After nearly 2 decades of work, how do you define a healthy lifestyle for women and girls beyond physical health? Now, especially within systems that we live in, which is constantly shaped by stigma and silence towards women as well.
Well, what I have known is that if you have a constitutional provision and if you have SDGs saying that women has to be focused upon or health has to be a priority, I still believe that at the ground level, what we've always seen is that education and health go hand in hand. And I did one of my projects with one of the leading companies wherein we dealt with adolescent girls and adolescent children, just teaching them to have healthy food versus all the junk food that they were having. So, and this was with elite schools, the top-notch schools of Vadodara. And so when we say that health is an issue, it's not just an issue catering to one socioeconomic strata. Maybe you say that the poor do not have access or the ones who are below poverty line do not have access. The story isn't like that. The story is that even the elite schools and the elite children or elite women who have access to all the kinds of gourmet fruits and food also, if not educated as to what keeps them healthy and not just physically, even in making choices as to what do I do with my body, how do I exercise, when do I get up, how do I maintain my menstrual hygiene, what are my sexual choices, and even what are my choices when it is about reproduction. It is a total gamut of things, and if that does not come, if the women does not get to decide that, if the girl does not get to decide that, we are looking at a very different India in the near future. A major concern these days in villages is underweight anemic girls giving birth at 19, 20 to still babies or to underweight children. They can be male or female. So yeah, health just does not mean the physical aspect of it, but how you think, how you live, how you make choices, and eventually how you own your own body as well.
Yes, ma'am. Very truly said. Substance abuse, as you ma'am know, among women, it is often hidden due to the social stigma. Rather than ignorance, it is more about shame. So, from your work with addiction-free programs, especially for girls, how do addiction affect women differently, and what social consequences do they have to bear as an individual, their families, and eventually the community at large?
Right, good question. Why? Because addiction and addictive behaviors. So normally when I go to schools and ask, there'll be a section boys and girls, right? And then girls will be sitting and being coy and sly. कि हम तो एडिक्शन करते नहीं है, हम कोई दारू नहीं पीते, हम सिगरेट नहीं पीते हैं, तो हमें क्यों बिठाया गया है, right? And then there comes a concept called addictive behaviors, and a lot of us get into addictive behaviors where we practice self-defeating behavior. Yani when I'm angry with my father, when I am angry with someone at the work, or when I'm angry with my someone in person in the authority, I can't speak against. The one thing I do is harm myself. मैं खाना नहीं खाऊंगी. You must have heard that.
Yes.
And that's prevalent with girls even today. Any girls. And there's so much of addictive behaviors that is ingrained in our society itself. उसको बुरा लगा है इसलिए वो खाना नहीं खाएगी. या इसको बुरा लगा है इसलिए वो ऐसा बिहेव कर रही है. She won't stand up for her rights and say that this is what I want, but she will kind of get into self-defeating or self-harming behaviors, right? So whilst I started working in addiction, and specifically, I always said that I won't get into patient treatment when I started off. Eventually, I realized that all of us are addicted in certain levels and in certain things, right? So we need to address this not just from addiction as a substance abuse disorder point of view, but also from an addictive behaviors point of view, which affects everyone, which affects your thought. So it starts with physical, psychological dependence more than the physical aspect of having some substance. And that can be common to anyone. It does not have anything to do with the gender. Another fact is that these days I am getting a lot of inquiries, and we do not have one center in Vadodara or in Gujarat which will cater to female patients in substance abuse, right? So, and there is a growing trend now. It is no longer a taboo, no longer a shame, no longer. It is a my right, my body, my right. You know, it is so rights go with responsibility is not taught. Like mera, I can make my choices, and the choices. So this again goes back to history. If you give me a minute, so when there was a suffrage movement going on in the West, the tobacco company asked the people, I mean psychologists, how do we increase our market? Because we've taught all the men to smoke and whatever. So they said when the women walk on the street and ask for independence or suffrage, you get them to smoke. And even today, when women want to show that they are independent, when today women want to show that they are, making their own choices, the first thing they predict it as or show it as smoking and drinking, right? And that's been going on till today. And this is like some 40 years back, right?
Yeah.
Suffrage movements were in 60s and 70s, even more than that, right?
Yeah.
Almost 60 years to it. So yeah, it goes hand in hand, like
Yeah.
when you say you have a right to your body, you have a responsibility more to your body also.
Yeah.
For any gender.
Anyways, ma'am, pro-life and pro-body choices, that is the,
Yeah, trending.
Yeah. Ma'am, next question is about in your HIV or AIDS work, many women they face not only the medical diagnosis but the social exclusion, the blame, the abandonment that they go through from their family, society. Now, how do women living with HIV first of all reach you, and then what are their most urgent pleas? Like, are they legal, emotional, medical, and how do they often reach you, and then how do you deal with those?
Yeah. So we are actually working with the government systems only. So all of our programs are intertwined with the national AIDS program currently right now. So getting women, they are diagnosed through the medical camps that we do in our respective areas. So we are assigned areas wherein we can carry out medical camps and the testings that are required for HIV, and eventually find out if there is any women who is having HIV positive virus in their body, right? Now, I always talk about HIV and say that the disease does not kill you, but the stigma around the disease, that is which breaks the women or breaks any person who contracts HIV, right? It becomes X time vulnerable for women. Why? Because see, there's this very common notion of men. See, it's again a very social and a moral issue also, because generally it's always connected to the sexual choices that anyone makes, right? And for men, it is given our societal structure that it's obvious that he would have partners around outside, but women wouldn't have partners around, even if she's got it from her husband, So it doesn't become so much of a medical issue, right? So if you have diabetes or BP, it is a medical issue. But when you have an HIV, it becomes directly proportionate to the moral, social, and the cultural issue, right? Under my projects, I work with female sex workers also. And now I find they are called a bridge population. And I find them more aware and awakened towards their body choices and towards their medical choices in terms of using condoms before any encounters. But when it comes to common population and specifically women today, they are making bold choices on their own, yes. But the stigma around the same is X times more for a woman than a man, which is very obvious, right? and even the medical repercussions of the same owing to the age factor also. So menopause and HIV multiplies, right? And HIV anyways is a opportunistic infection disease also, right? So it multiplies X time being a women as a gender, right? So yeah, it has more impact on women than what I have seen than on men in general. Right? Yeah.
Having worked with institutions like the Ministry of Health and WHO, how can healthcare policies move beyond just the policy making token inclusion to genuinely make it women centric at the grassroots level, and how to execute them efficiently?
So see, there is a study called as Global Adult Tobacco Survey, right?
Okay.
And it has Gujarat data also. And it says that about 10% women currently are consuming tobacco in any form, right? And all of our programs and policies, so program policies have interventions like tobacco-free educational institutions, tobacco-free villages, right? Tobacco-free workplaces, and you have sections and section initiatives around those sections, right? And our current focus, and when we were attending one of our international conferences, and our current focus, and the last initiative that we did with the government of Gujarat, and specifically the health department, was providing nutrition kit to ANC mothers. Who are ANC mothers? The mothers who are pregnant in their first trimester, whatever trimester, right? Why are we giving them kits? I work in tobacco control. I do not work in RCH or reproductive child health issue. No. Why was I giving them kits? Because these women were underweight, one, and second, these women were consuming tobacco, right? And they were pregnant at the age of 20 or 21, right? And to give them this knowledge that this is harming your body, because in the afternoon hours when they do not have anything to chew or anything to do, the only thing they are doing is one sachet, they'll get it, they'll keep consuming it for 2-3 hours, right? It kills their time also and even fills their hunger also, right? So this becomes an issue, right? And what are we looking at? A 21-year-old underweight giving birth to stillbirths or underweight children, right? Who are, and all the time of birth given into the ICU itself. So all of the policies that are made now need to start focusing on gender specific interventions also. And gender specific in terms of adolescent girls, in terms of ANC mothers, in terms of old age women, right, who have consumed all the day. So we just don't need sensitization and awareness. We also need treatment programs that focus specifically on women also. So this is just one example that I'm giving you from the tobacco control perspective. But there are other areas also, like for HIV also, I told you, right, that focusing specifically on women emotional needs during those times, when they are diagnosed as HIV positive, or when they are into their trimesters of pregnancy. How do you deal with women issues of changing bodies also? So it really needs entirely, the entire medical science needs to be now focusing on women issues as well. How medical science has always given standardized protocols for human beings or men. So we need to get to the core 51% of the population that is on the earth, right? So yeah, we need to do that as well.
Yes, ma'am. No, very correct information and all of that. Males and females, as you said, males always have had this superseding, persona in the society that we need to, after making policies, we need to change them. Now, moving forward to the next question. I also would like to ask you that during COVID-19, migrant women struggled to access sanitary products and basic hygiene.
Right.
Now, how did your organization particularly intervene at that time, as we knew the protocols were very stringent and tight at that time? And what did this moment expose about how, these kind of crises deny women the access to their basic rights and basic hygiene?
So I'm someone who travels very frequently, travels in the state, out of state. I mean, and the one thing that I see is that men-women toilets, Manati, great job you've done, right? On the highways, accessible and all that. But, and I always also quote this, and this is going to be my observation totally. So when you go to a women's toilet, it won't be reeking of urine, okay? And you will never find blood spots of the menstrual cycles, right? You might find pads or might not find pads. Okay, but if there's always a saying, if men had to menstruate, by this time we would have been, having pharmacies and places where everyone
Yeah.
pads are accessible to
Yeah.
women, right?
Mm.
You were mentioning about COVID-19, and I still remember we were the only organization in Vadodara that was allowed to come to the railway station to distribute hygiene kits. One, because we needed masks and sanitary napkin. Sorry, what is that called? Sanitizers, right?
Oh, yeah.
So we needed the sanitizers. Then the need came up for sanitary pads because medical stores are closed, government hospitals are not allowing anywhere. So where is the access, right? So we had one of our CSR initiatives where we acquired some lakhs of sanitary napkins and then provided that at the railway station to the women who are going on requirement, as in, like, but yes, I see that general hygiene needs, like, so even today I carry a pouch in my bag which has my soiled sanitary pad which I dump at home, but I cannot dump it in the lavatory where I go and the public place, right? So that's what I'm saying, that you have built up infrastructures, but you are still not sensitive to understanding कि अंदर आने वाली 50 औरतों में से 25 मेंस्ट्रुएटिंग ही होंगी जिनको पैड्स चेंज करने हैं, कहाँ डंप करेंगी वो, right? I see that now in 5-star hotels, I see that in high-end places, but I don't see that still in, like, if you go to Ahmedabad, the Baroda Express Highway, you won't see that in the lavatories there. So yes, we still need very sensitive initiatives or programs or sensitivity towards the actual needs of the women, not just building up infrastructures, and again, not maintaining it or not being sensitive towards the entire thing.
Ma'am, as rightly said by you, legislative changes also need executionary ones, and not only to the top strata, but until the grassroots level.
Very true. Right.
Yeah. Ma'am, moving forward with the next question. Health issues, they often intersect with legal challenges for women. How do access to legal aid in civil and criminal matters strengthen women's health, autonomy, and social security that they have? And how do they deal with, like, a woman? How do they make their own choices?
So I believe all of the acts, whenever they were made, for example, medical termination of pregnancy, right? Women didn't have a right to choose the contraceptive method. One, then choose even her sexual rights, whether she wants to get into a sexual encounter or not. That, and then this is not just even domestic violence, even sexual violence in marriage, whether it is doable, I mean, it is legal or not, all of these are still a question in the practice of it, like if I go and say that I am sexually abused in my marriage, how valid is it, and valid in terms of how true is it that I will be able to prove it and say that, and then get a justice about that, right? And will that be even a ground for nullifying my marriage or whatever you want, whatever is the result to it, kind of. So, so all of the acts that were made, supposedly if you talk about dowry, supposedly you talk about the age of the marriage, right? What is that for? That is to protect the women as a totality, right? What is the, why age of marriage? Because then it determines the age of pregnancy, whether the body is ready or not. One of the first cases that I dealt with in my school, college age, when I was your age, was a 13-year-old girl who had been sexually abused in her family, and she had had a miscarriage, right? See, I'm telling you, right? So while we are talking about all of the things as legal, ye hona chahiye, ye hai available, what are the execution points at the ground level? Are actually women exercising that from the legal point of view? No, this is my right. I want to be married. I don't want to be married. I want to have sexual encounter. I want to use this contraceptive method. I want to have a baby or not have a baby. All of these have implications on women, not just the individual, but also the society. Lots of women today are opting out of marriage. Lots of women today are opting out of having or not having children, right? Why? Because they're educated enough now to understand that my body is my right, right? So laws definitely do help to protect a women's health, but not necessarily ensure that everyone does it or gets it, So you providing free legal aid gives them the confidence that अगर मेरे साथ कल को कुछ sexual abuse हो रहा है या मेरी शादी उम्र से पहले की जाती है, I can go to the court of law to seek justice. There's this one lady who works on annulment of child marriages only. I know of, right? And that ensures that the child gets the right to study, one, and marry at the right age with the right person, and have children at the right age.
Yeah.
Hence protects her body.
Very correct.
Right?
Yeah.
So yeah, of course, legal helps the health of the child,
Yeah.
the women definitely.
Yeah. Ma'am, as a follow-up question, like without naming the identities, of course, have you had any such instances where the women who came as a patient to you in any manner, HIV or anything, but then she had a completely different ideology and then she defied it, and then it also helped her during going through the legal journey that she went through?
Yeah, so most of the times, all of the drug addicts that come to me are men and the women seeking divorce from that men, right? And so I believe in restorative and restoration of the person and the institution of marriage, obviously, right? That's my job as an organization. So we will always give the choice to the person whether or not they want to be in the marriage, but we'll always help them understand addiction as a disease, which is a mental issue, right? And the legal repercussions as in, like, whether once the person is treated, whether you staying in the marriage or quitting the marriage is going to benefit you or harm you, right? So we've always had women who have, or even HIV positive females, or even let's say I said about child marriages because I've intertwiningly worked with adolescent girls who have eventually decided that they want to have a better future with their studies. Even if she's deciding that she wants to do graduation only and be a teacher, not a high-end job or a very demanding job or a very high-scale paying job, but she wants to be educated enough to take decisions for herself. So I believe that, meaning basically, it's very important that you give them this perspective. The education or legal aid is not just going to help you fight when you want to go for a dharna. No, it's going to help you live your everyday life. That is a perspective we need to put to people, especially girls.
Ma'am, it is always about the conscious choices that we make in our routine.
Right, true.
Ma'am, after training over 750 women in skills and entrepreneurship, what links have you seen between the economic independence, the self-worth, and a woman's control, mentally and physically over herself?
Well, I don't know if you've been following internet offlet and the hue and cry around the dual responsibility the women is taking up these days, So and the wage parity that goes on in the corporate world, right? And India being where I don't know in terms of wage parity and stuff like that. But we see that even, and I'm not talking about high-end corporate women, I'm talking about my maid. Okay, I always say that my house help, my maid is more empowered than any of us who are sitting in corporate offices. वो बोलती है मैं 2000 कमाती हूँ, मैं जो कमाती हूँ मैं डिसाइड करती हूँ मैं कहाँ खर्च करूँगी. That is empowerment. So I believe that economic empowerment or economic upliftment does not ensure that the individual will be uplifted. Okay, it is so we have a lot of women who are having white collar jobs and the finances managed by their husbands only. Right? So where is she empowered? Right? She doesn't know about the investments. She doesn't know. वो मेरे पति देखते हैं. Besides, she just goes, does her job and comes back and strictly does her job 9 to 5, or 10 to 5, whatever, right? And she comes back and the account, she doesn't know where her checkbook is. She doesn't know where the investments are. She does not know कि घर किसके नाम पे है, if she's a co-owner or she's not. That is not empowerment. Empowerment is exactly where there is equality, where there is equity, and where there is decision making which is mutually consented. Right? प्यार के नाम पे, संस्कार के नाम पे, इज्जत के नाम पे, एम्पावर के नाम पे आप उसको पैसा कमाने दे रहे हो, पर वो डिसाइड नहीं कर सकती है she's not empowered. A woman is only empowered as much as she thinks she is empowered. Okay? Only if you have the right to think and to act upon what you think, you are empowered. So I strictly believe and I strongly say financial liberation does not ensure empowerment.
True.
Right?
Yeah.
Only your decision making about the finances ensures whether you're empowered or not. And that is equivalent then to your self-worth also.
Yeah.
Right?
No, very true. Quantifying anything does not mean it has necessarily changed the quality of
Right.
that aspect.
Exactly.
Yeah. Ma'am, as an ending question, I would like to ask you if women's health, sanitation, legal protection, and livelihoods, they are all so deeply interconnected, then what kind of systemic shifts are truly required, and what responsibility do young people, we as both the genders, males and females, carry in ensuring these conversations that they go on and then they also lead to actions, as you said, and not just awareness?
Right. So you're talking to someone who's in the field 20 years now. So I've seen, and I still see this. Okay, the slum school that I'm running today is in the heart of Vadodara, and it is run for dropout girls. Okay, and it is run because those girls do not have an access to a school across the street, because the school is in the high area of the higher community than the girls that they belong to a certain community. So just as you said, all of the things are intertwined: social, economical, financial. All of the things are so intertwined. What we need to do, so when you say that 33% is what is allotted, what is the election percentage of women today voting? 51% of women are the voters list. I don't know what the current census would be, but that is the voter list long back, right? 51%. So why are you talking and barging and bragging about 33% being given, right? What I'm saying is that I also do not believe in equality of sexes, right? I believe in equality of the genders, right? Men and women were reproductively created differently and different roles to do so that they can complement each other. That doesn't make someone less and someone more, right? You have to talk about things from the equity point of view, right? Any man my age has the same brains that I have, and I believe I have more guts than the man of my age. Okay, right? Because meaning, if we want an egalitarian society in terms of gender, we have to actually talk about equity. We have to actually talk about equal opportunities, right? Starting from the birth to the point of being able to, even when you मुखाग्नि देते हैं ना आप to the dead person, तो मर्द सिर्फ देता है in the current this thing. Why not the women if she's the only child, right? So to that, from birth to death, you have to actually go down to the minuscule point of view to analyze where we have to have equity parameters and not equality. मैं versus आप नहीं हो सकता है, हम साथ में चलना चाहिए. तो ही you can expect that there are better things or better world for the next gen to come. Otherwise, you will always have competition, you will always have constraints, and you will always have me versus you. That's not how the next gen or the society hereafter is going to be doing it, right?
Ma'am, in political science, as students, we study the concept of 3 C's: conflict, competition, but at last it is also cooperation that we need to do. Exactly. So that was, ma'am, a really wholesome answer to conclude this podcast. It was really good having you. I got a real introspective and reflective answers that I have upon me.
Right.
Thank you, ma'am.
Thank you for having me. It's been my pleasure. Thank you. Thank you.